Pediatricians are pretty beloved. I mean, we're the people out there with, the soft voices and the bow ties and, smiles and pinwheels and things like that. And you don't go into pediatrics really expecting to be attacked for the care that you provide.
In recent weeks, several children's hospitals have become targets of far-right attacks.
The FBI has arrested a woman for making bomb threats to the Boston Children's Hospital.
A growing number of doctors say they are under threat from far-right activists because they care for transgender patients.
There's sometimes attacks on health systems, people contacting to complain or share comments that are threatening, like bodily harm should come to me for the care that I provide. It's shocking. It's just never something I thought would be part of my career. I'm a pediatrician because I think that every child deserves to meet their optimal health outcomes. I want every kid to be the healthiest they can possibly be. And for me, that also includes transgender and gender diverse kids. Gender affirming care is providing a supportive environment for kids and families to ask knowledgeable healthcare providers, whether they're doctors or psychologists or anyone who has experience caring for transgender and gender diverse kids, how to understand and interpret what's going on with their child. If the child is young and they're experimenting with gender expression, what do they do about it? How do they support them? Are there certain questions they should or shouldn't be asking? What should they do if a child gets picked on at school, or should they talk to the teachers? A good majority of what we do is have long, thoughtful, emotional conversations with kids and families about how to provide love and support. We live in a time where there is a lot of rampant misinformation out on the internet that people can easily access. So I do want people to know that when we say gender affirming care, we are not talking about giving medications to very young children. That's just not something that's a part of what we do. We are not talking about surgeries on children. That's just not really a part of a care approach for kids. Certainly surgeries and other medical procedures can be things that transgender people have as a part of their care, but that's not how we start this care with kids. This fear of what's going to happen and will my child be targeted, or will you be targeted, or will this clinic be targeted, is really causing an everyday fear in the lives of kids and families. Kids and families deserve somewhere to go to get their questions answered. And if my child had diabetes or cancer or asthma, I deserve to be able to go to an asthma specialist to find out what things can we do to make it better, what things might make it worse. And if you have a child who is transgender, you deserve that same thing. At just a real basic fundamental level, kids deserve health care that is specialized and tailored to their healthcare needs. Transgender kids deserve that too.